In this video, you will see how to give a medicine through a G-tube or J-tube. Before giving any medicine, be sure to check with your doctor the following. Do you give the medicine on an empty stomach or a full stomach, or does it not matter? Ask if the medicine can be prescribed in liquid form. It is easier to give medicines in a G-tube and J-tube when in liquid form. If the medicine is only available in pill form, then it must be crushed to a fine powder and dissolved well in water before giving through your child's tube. Ask the pharmacist whether you can crush the tablets or open the capsules yourself if the liquid form is not available. Learn the names of your child's medicines and know the reason why your child needs them. Ask if the medicines can be given at the same time or if they need to be given in a special order. Some parents keep a calendar to keep track of medicines. Now, let's see how to give a medicine through a feeding tube. Wash your hands. Gather all the supplies you will need. Medicines. Have them drawn up in syringes ready to go. Water for flushing, either in a cup or a syringe. Extension set if your child has a button type of tube. Syringes. Your child's tubing may have a medicine port. This is a smaller opening than the one used for feedings. If your child has this port, you must make sure the feeding port is closed when using the smaller medicine port. If your child has a button type of tube, attach the extension set. If your child is in the middle of a feeding, you may need to pause the feed. Clamp the tube. Open the med port and insert the medicine syringe into the med port. Now, unclamp the tube and push the medicine into the tube. Clamp the tube. This will keep the medicine from coming out. Remove the medicine syringe. Draw up 5 to 10 mL of water into a syringe unless told otherwise. Attach the syringe of water to the medicine port. Unclamp the tube. Push the water through the tube. Clamp the tube and close the medicine port. Don't forget to remove the extension set if your child has a button tube and put away your supplies. If your child's G-tube does not have a medicine port, the tubing will only have one large opening. To give medicine through this type of tubing, follow these steps. Clamp the tube. Attach a larger empty syringe without the plunger into the tubing. Pour the exact dose of medicine into the syringe. Unclamp the tube and let the medicine flow into the tubing, as you would if feeding by gravity. Sometimes the medicine might not move through the tube. You can either milk the tube by gently squeezing it, or you can use the plunger from the syringe and give it a slight push into the syringe. Once the medicine is emptied from the syringe, you can pour 5 to 10 mL of water into the syringe. How much to pour depends on your child's age and what you were told to give. Again, you may need to help the water flow through the tube. Once all the medicine and water flush is given, clamp the tube. Remember, it is important that you flush between each medicine. For example, if you are giving 3 medicines at the same time, give one medicine, give a water flush, then give the next medicine, do another water flush, give another medicine, do another water flush. This will help the tube from clogging. Thank you for watching.